Madam Secretary, many of us were shocked and saddened by the horrific murder of Dr. George Tiller over the weekend, and for years the Bush administration went out of its way to protect doctors from being forced to provide services they found objectionable, yet did nothing to shield physicians providing legal and life-protecting medical care to women from ongoing harassment, threats, and violence. This is unconscionable and must change. In my judgment, the federal government must send a message that acts of violence against healthcare providers will not be tolerated. I was pleased to learn that Attorney General Holder has indicated that the U.S. Marshal Service will begin protecting certain abortion clinics and doctors, and this is a good first step. Today, the New York Times also called on Attorney General Holder to revitalize the National Task Force on Violence Against Healthcare Providers that was originally established in the 1990s. Now, I realize this task force would be under the jurisdiction of the Department of Justice, not HHS. I want to know, number one, would you support its revitalization, and how does HHS intend to work with the Department of Justice to ensure that these acts of violence are eliminated? And do you agree that this type of violence could discourage medical schools from teaching doctors how to perform abortions? And how will HHS work with medical schools and provider organizations to ensure that this procedure is being taught?
Well, Congresswoman, I share your interest in making sure that health services are delivered within the law, and that providers certainly are protected for their activities. And the Attorney General was quick to reach out and make it very clear that acts of violence would not be tolerated, that he would use the assets of the Justice Department to provide protection, and I think to also send a very strong message about acts in the future that would be prosecuted. I am not familiar with the task force that you've described, but would look forward to working with you on that, to taking a look at it if it's revived. I think the jurisdiction, as you note, is really within the Department of Justice, but certainly having providers be able to deliver health services to men and women across this country is essential.